Hello, this is Dr. Stanley Lang. I'd like to welcome you to this video and like to share with you the contents of a conversation I had with a patient that has severe insulin resistance that is the major source of his severe coronary disease. This person, about 4 years ago, almost died on the table. He was resuscitated successfully. And since then, he's done a reasonably good job of trying to follow a healthy lifestyle, and we've had multiple discussions on how to reverse insulin resistance and why you might want to do that if you've got heart disease. Now, why would you want to do that? Well, because insulin resistance syndrome, which is part of the prediabetes and the diabetes spectrum, is the major driver of coronary disease. So it's what inflames the arteries the most. So it's the big risk for heart disease progression, for new heart disease if you're developing it for the first time, or for stroke, and also for multiple cancers. So the question that we talked about is, how much of the time do you have to follow the program to be able to reverse the insulin resistance? Now, the program involves elimination of high glycemic foods. So how often do you have to do that? 60% of the time, 70% of the time, 80% of the time? Is that good enough to reverse it? And I told him that in my experience, that patients had to be almost 100% compliant with eliminating high glycemic carbs if they wanted to reverse the insulin resistance. Now, you can go a long ways in terms of decreasing some of the risk and feeling better and by just cutting out a lot of the high glycemic carbs. But if you don't completely eliminate it, in my experience, you won't reverse the insulin resistance and it will progress. So for somebody that's seriously wanting to decrease the risk as much as possible for progression of their heart disease or their risk of stroke or the other conditions that prediabetes causes, the target is to totally eliminate all high glycemic carbs. Now, you might not have to do that forever, but you're going to need to do it for at least a year to be able to reset the body's chemistry and to try to get it back to what it was before it got damaged into this pre-diabetic insulin resistance state. So that's what we talked about, and he's going to think about whether he wants to make the sacrifice to give up all of the high glycemic carbs or not. So I encourage you to think about it. You're not going to get to the target if you don't go all the way. Halfway, I tell my patients, halfway is no way. So I wish you well, God bless, and have a good day.